Okay, let's kick off this deep dive with maybe a slightly unsettling question, a strange one perhaps.
Go for it.
What if that pill you take every single day, for something that seems minor, like say heartburn or maybe just to help you drift off at night, what if it's quietly, kind of sneakily increasing your long-term risk of dementia?
Yeah, it sounds a bit like something out of a thriller, doesn't it?
Yeah.
But it really gets to the heart of what we're exploring here today.
Right.
Most people get that, okay, one drug has side effects, that list is long enough, but very few really grasp the actual fallout from taking multiple drugs together,
Mm-hmm.
especially over years and years.
It's not just taking three separate things, is it?
No, exactly. You're basically mixing up this chemical cocktail inside your body.
Exactly. So our mission here is really to unpack how these common prescriptions, the way they interact, and maybe the elephant in the room diet, how they all combine, they create this incredible, almost self-feeding cycle of poor health.
Yeah, a cycle's a good way to put it.
Think of it like your body's running on this super complex computer, right? And you keep adding new apps to fix problems the old apps caused.
And eventually,
The whole system just PFT crashes.
right. And what's really fascinating, or maybe scary, is that your body's chemistry. It doesn't care which doctor prescribed which pill. Dr. A, Dr. B makes no difference.
It just deals with the total load.
The total chemical load, exactly.
Mhm.
So we're going to dive into just how complex that chemistry gets and what simple thing might be getting totally overlooked that could actually stop this whole chain reaction.
Okay, let's jump in. We've sort of identified these brain saboteurs,
Mm-hmm.
common drugs, right?
Mm-hmm.
Linked strongly to messing with cognitive function.
Yeah, and a major way they do this is by inhibiting or blocking something called acetylcholine.
Acetylcholine, okay. Sounds important.
Oh, it's crucial. Think of it like the brain's main messaging system, like texting for your neurons. It's key for memory, attention, learning, all that good
So
stuff.
if you block it,
You're literally disrupting the brain's pathways for holding on to information. Do that for long enough, and, well, it's kind of a recipe for cognitive decline.
okay, so which drugs are we talking about? Because I have a feeling these aren't like rare prescriptions.
No, not at all. Incredibly common. The first big group has what we call anticholinergic properties. Fancy word for blocking that acetylcholine messenger.
Right.
This includes really popular antihistamines,
Yeah.
like Benadryl. Lots of people pop one every night for sleep.
Yeah, I know people who do that.
It also includes certain types of depression meds and, maybe surprisingly, really common drugs for an overactive bladder.
A bladder pill affecting memory.
If someone's on them for years, yeah,
Mm.
the dementia risk goes up significantly. That's a prime example of systemic interaction, fixing one thing, potentially harming another.
Wow. Okay, what else is on this saboteur list?
Next up, we've got the drugs often used for anxiety and sleep, benzodiazepines.
Yeah, like Valium, Xanax.
Exactly. We know those names. They're designed, obviously, to calm the central nervous system, reduce anxiety, help with sleep.
Hmm.
But long-term use, it's associated with a higher risk of cognitive decline, sometimes even insomnia, confusion.
The opposite effect, almost.
Sometimes, yeah.
Yeah.
Now, brace yourself. Are you taking anything for tummy troubles?
Oh, no. Don't tell me my heartburn pill is on the list, please.
Okay. Medications for indigestion, chronic heartburn, the proton pump inhibitors, PPIs, things like Prilosec, Nexium,
Yeah.
they're also linked to increased cognitive decline.
How? What's the mechanism there?
It seems to be because they reduce stomach acid so much. And you need that acid to properly absorb vital nutrients, like vitamin B12, for example.
Which is crucial for the brain.
Absolutely essential for brain health, nerve function. So if you're on PPIs long enough, you could essentially be starving your brain of some key building blocks.
Okay, so that's less about chemical blockage and more like nutritional starvation. That's almost more alarming, isn't it?
It's a different angle, yeah, equally concerning. And the last category here, these are the heavy hitters, opioids.
Painkillers,
Air-
morphine, oxycodone.
Right, and also certain anesthetics used during surgery. Basically, anything that causes heavy sedation on the brain can really affect cognitive function and potentially increase that long-term dementia risk.
It really makes you think, doesn't it? If just one of these is risky, what on earth happens when people are taking like 5, 10 all at once?
And that brings us neatly to the, frankly, shocking reality of what's
Yeah.
called polypharmacy.
Polypharmacy, taking many drugs.
Right, the simultaneous use of multiple meds.
Yeah.
We heard this anecdote from an owner of assisted living facilities, and the numbers are just staggering.
Okay, tell us about this pileup.
Well, she observed that new residents, They often arrive taking, on average, maybe 20 to 30 different medications.
20 to 30. Okay, that's already a
Like,
lot.
wait for it, their record high. A single gentleman who was taking 54 different prescription medications.
54. I mean, I can barely keep track of my keys. How do you even manage the schedule for 54 different chemicals every day? That sounds like a full-time job just for the pharmacist, let alone the patient.
It's absolute chaos. And it's fueling something we call adverse drug reactions, ADRs.
EDRs.
These are basically unexpected side effects, not caused by one drug acting alone,
Right.
but by the interaction of two or more drugs mixing it up inside your system. This is the so what of that massive pileup.
And I have a feeling the so what is pretty bad.
Genuinely terrifying.
Yeah.
ADRs. They're responsible for about 10% of all hospital visits nationwide.
10% just from drug reactions.
Yeah. And here's the statistic that should really make everyone just pause for a second. Complications from prescription drugs, these ADRs, they are shockingly the fourth leading cause of death.
Wait, fourth? Ahead of what?
Think about it. You've got heart disease, cancer, accidents, and then number 4, complications from the very things designed to fix us.
That's profound. And this whole thing is made worse by the specialist problem, right?
Oh, absolutely. The complexity just skyrockets. You might have, say, 5 different doctors, a skin doc, a hormone doc, a heart doc.
Each focusing on their little patch.
Exactly. Each one is zeroed in on their specific body part or system. They're often not looking at the total chemical load. They don't see the whole interaction cocktail that's brewing.
Is it? I mean, are doctors just not paying attention?
It's not necessarily malice, I don't think. They're incredibly busy. And those warning inserts, the package leaflets, they're practically unreadable. Microfont, dense legal language.
Right. You need a magnifying glass.
They rely on software, sure. Things like Hippocrates trying to flag the big interactions. But with thousands of possible combinations, the system is just fundamentally set up for things to slip through the cracks.
And that leads to these simple, you'd think, preventable overlaps.
Totally. Like you get 2 different specialists prescribing 2 different drugs. Maybe one's for blood pressure, one's for, I don't know, allergies. But oops, both have a major side effect of drowsiness.
So now you're walking around like a zombie. Huge fall risk.
Or maybe both cause constipation. We talked about that mother-in-law example before we started, remember?
Yeah.
A common bladder medication prescribed to manage frequency.
Yeah.
But it had dementia listed as a known long-term side effect. So the bladder specialist fixed the symptom down south, so to speak, but was potentially undermining the brain up top, and maybe nobody connected those dots. The patient certainly didn't know.
That realization that a huge piece, maybe the foundational piece, is being ignored, it kind of leads us to the solution, doesn't it? And it's one that ironically sounds almost like radical cutting-edge therapy.
Takes a breath. Yes.
Ugh.
The truly complex, the utterly revolutionary strategy,
Yeah.
the one that's transforming lives drowning in polypharmacy,
It is.
simply introducing real food.
Laughs slightly. You gotta love the sarcasm there, because it is framed like some radical new treatment, isn't it? When for a lot of institutions, maybe nursing homes, hospitals, their budgets kind of rely on highly processed food.
It's cheap, it's shelf-stable, it's centralized. They've got massive contracts for stuff where you practically need a chemistry degree to read the ingredients list.
Seriously. Hydrolyzed soy protein isolate.
Right. But when these places actually shift their focus, when they prioritize real nutrition, the results are, well, they're almost miraculous sometimes.
Okay, like what?
Remember the guy with 54 medications?
Yeah, 54. Hard to forget.
After they focused on getting him real food, cutting out all the processed junk, he's now down to around 20 medications. And get this, he's living on his own again, in an apartment.
That's genuinely powerful. 20 meds is still a lot, but from 54 and living independently.
It's life-changing. We're talking about people literally graduating from hospice after making significant dietary changes.
Graduating from hospice, that shouldn't even be a phrase. That's turning the whole ship around.
The physical changes can be incredibly rapid, too.
Yeah.
We heard about bedbound patients starting to walk again, hormone levels, vitamin D levels shooting up, inflammation markers going way down.
Inflammation seems key.
It underlies almost all chronic disease. Oh, and there was a 98-year-old guy, became physically capable enough after dietary changes to go on a cruise with his family. He wasn't chemically depleted or nutritionally starved anymore.
A cruise at 98. That's fantastic. So what does this miracle menu look like? What are they actually avoiding?
The avoid list is pretty straightforward, actually. Basically, anything from the middle aisles of the grocery store.
The packaged stuff?
Yeah, any packaged food. and especially any added sugar. They pointed out there is something like 65 different names for sugar hiding on labels.
65. That's not nutrition, that's a shell game. You need a decoder ring just to figure out what's in your cereal.
Exactly. So the core rule is beautiful, really, in its simplicity. Focus on one ingredient foods.
Like broccoli or steak.
Right. Things that are the ingredient versus foods that look like they escaped from a chemistry lab.
Which leads to that comparison, the joke you mentioned.
Ah, yeah. Why is it that the first thing a vet asks about is your pet's diet? But often, with human doctors, that essential component gets skipped.
It's wild, isn't it? Because the vet knows that nutrition is the fuel. It's the foundation. If the fuel is junk,
You're going to get chronic problems. Which brings us, unfortunately, to the dark side of this whole system.
the vicious cycle.
Exactly. The vicious cycle of treating symptoms with side effects. This is where that domino effect really picks up speed.
Okay, let's break down the actual trap mechanism. Because the meds create new symptoms,
Right.
which then need more meds, and the patient is stuck in this loop, which, let's be honest, is pretty profitable for everyone except the patient.
Right. Take constipation. Super common side effect, right?
Hmm.
Over 150 different meds can cause it. Often things like blood pressure pills, pain meds.
Okay, so the doc prescribes a laxative, fixes the symptom.
It fixes the symptom, maybe. But here's the kicker. Chronic laxative use. It can actually damage the lining of your colon. It can cause chemical dependence where your body literally forgets how to function without it.
So a side effect created a whole new chronic problem requiring ongoing treatment.
Precisely.
Yeah.
Or here's another one, diabetes medications. Some common types work by pushing excess sugar out of your blood through the kidneys into your urine.
Lowers blood sugar. Looks like success.
Looks great on the labs. But now the patient might have urinary symptoms, like they're peeing constantly, annoying, disruptive,
So they go back to the doctor.
who then prescribes new meds for urinary retention, trying to slow things down. But guess what a common side effect of that retention drug is?
Oh, no. Let me guess. UTIs.
Bingo. Increased risk of urinary tract infections, which then require antibiotics. See the cascade? First, drugs mechanism, new symptom, new drug, new side effect. Infection, it just keeps going.
And then there's just dizziness. Seems minor, maybe.
Until you fall. Dizziness is a super common side effect. Blood pressure meds, antidepressants, sleeping pills, all notorious for it. And what's the ultimate consequence of being dizzy, especially if you're older?
Falls. Broken hips.
Exactly. It is the #1 cause of falls in the elderly. Often leads to broken hips, long hospital stays, a massive decline in quality of life, even death. The cure is literally causing potentially life-threatening injuries. And maybe the peak of irony here is what we call paradoxical effects.
Taking a drug for one thing, getting the opposite.
Precisely. You take an antidepressant, but it actually increases negative thoughts or agitation in some people. You take an antacid for heartburn, stop taking it, and bam, rebound heartburn. Often worse than before. The drug itself perpetuates the problem.
This is why zooming out, looking at the whole picture is so critical, isn't it? The reason this whole kind of catastrophic cycle holds together, it seems to be the omission of real food. Right at the start, in the diagnosis, in the treatment plan.
That's really the synthesis, isn't it? You've got processed food driving chronic disease, creating inflammation, nutrient deficiencies, and then Big Pharma steps in very efficiently to treat the consequences. The symptoms, the side effects, often caused or worsened by that junk food foundation.
So the connection between the chemically laden junk food in the pantry and the chemically dependent medication schedule from the pharmacy, that's what's holding the whole system together.
Seems like a major part of it. So what does this all mean for you listening right now?
Well, the one thing, maybe the simplest thing, that could potentially turn this whole pharmaceutical spiral around, maybe eliminate multiple prescriptions down the road. It could be a tiny change right at the beginning,
Just switching out the junk.
switching out the chemically complex stuff for simple, real food. It sounds almost too simple, doesn't it?
It really does. So maybe the final thought for everyone listening is this. If the foundation of your own lifestyle car, let's say, is nutrition, what results could you see? If you just started reducing the things that look like they came from a chemistry lab, whether that's from your pantry or your pill bottles.
And focused only on the ingredients that truly nourish. What simple switch, maybe just one thing, could start to disrupt your current medication flow, or maybe prevent needing more down the line. Something to think about.